This is DJ.
And this is Ish.
And this is
Season 6 of
Pero Let Me Tell You.
All right, oye mi gente. Now we have with us here today somebody who, many times we all say, oh, there's a problem, and we want to fix it, but we don't know how, and then we can't figure it out, and we don't take the steps. But we've got with us today somebody who has decided to really, put her experience and her knowledge into making a change into how healthcare is affordable for just all of us, really. She is the founder and CEO of Dr. Good Price, and we have with us today Jessica Gonzalez. Thank you for joining us.
Thank you so much for having me.
So, first and foremost, I've been to Dr. Good Price. I've seen it. It's fantastic. Just the fact that it's an urgent care. It's got lab tests. It's a pharmacy. I think a little bit more, and we can probably also do dry cleaning there, right? It's a one-stop shop. How did this idea come to you? Like, where did Dr. Good Price start as far as an idea?
So for 15 years in Mexico, I worked in a company that has pharmacies and doctors right next door, doctors' offices. So it's a very similar concept, and that's where it started. But and the real motivation, behind this, is, and I've always been interested in helping people. So I've been in the nonprofit world also for all my life. This is a for-profit company, but it's what I like about it. It's that it has social impact,
yes.
and because it's for-profit, it's scalable. You can grow it, and you can and it's sustainable. Whereas nonprofits, if I were to do this as a nonprofit, it would not be scalable, and it would not be sustainable in the long run, right? You run out of money, and then you're done, right? Here, the good thing is that you can grow it, and it's going to keep on going, and helping people at the same time.
Yeah, and look, I love profit as much as the next person, but what I love about your, from what I've seen, is that it's profit sin descaro, shall we say. It's not about gouging people. It's about, yes, you have to make a living and you have to pay your expenses, but people also should just be able to have access to healthcare and to labs, and not also have to wait 6-7 months. Even if you have insurance, sometimes you call up your doctor's office and it's like, oh yeah, we've got an appointment for you in, January of next year. And it's like, yeah, but I need someone now.
But I didn't say my story completely. I worked 15 years in Mexico in this company, and then I come to the US to live here. I never thought in my mind this could be an option here. But then I realized here healthcare is so inaccessible. I hadn't realized, because I had to come always as a tourist, visiting.
Yeah, why would you know?
Yeah, but then you're in the first world and you realize it's also almost impossible to get healthcare. And that's where I was like, oh, here that concept could really work.
Yeah, absolutely. And, like I said, even when you have insurance, it's sometimes very difficult just even to get an appointment, right? So it's like, technically on paper, you have healthcare, right? You have the insurance, the means, but you can't even get to it sometimes. And that's just insane to me. Now, you mentioned that, your background, obviously, you have about over 2 decades in nonprofit, but you also have 15 years in pharma. Now, I have to tell you, my background is in marketing. I did pharma marketing for about a year, and it was insane to me. So the fact that you have 15 years of background in pharma says to me that you are somebody who is not only intelligent, but has a hell of a lot of patience and understanding of, trials and how long things take and how to make it, actually happen. Do you feel like your background in pharma helped you to be able to put this together and, give you a point of view that maybe most people wouldn't have?
Yes, of course. Well, my background is not in pharmaceutical manufacturing. It's more in sales.
Okay.
So it was in retail pharmacy. And I worked in many countries. I worked in Chile, I worked in Guatemala, I worked in Argentina, in Mexico, all of these in pharmacy, in retail. Mm-hmm. And I obviously, this was a big thing for me, having this experience and knowing how this whole world works, right? With the drugs and pharmacy. And also my background is with doctors, because in Mexico I did a lot of work with doctors and medical records and things like that.
Oh, dealing with doctors, that requires a whole other level of skills, because doctors can be an interesting group to work with, I'm assuming.
Yes, you know what we do here? We let them be autonomous. That's what I love. Like,
Yeah.
they're the doctors, they're the experts. We don't tell them what to do or how to prescribe or how to anything, right? That's also a very important part of our model, because our doctors are not salespeople. They really want to cure the patient, right? So we don't get involved at all. So yes, doctors, I've learned you always have to respect them and respect their autonomy. They studied for such a long time. They know so much more than, well, at least I could know. So I love working with doctors.
I love that you say, they're doctors, they're not salespeople. And I guess as a former salesperson yourself, in the pharma space, you can understand how that line has to be drawn, right? I think a lot of times the perception that many patients may have is, oh, this doctor's recommending this because they're being a salesperson, so to speak. So I think that's very interesting and important to call out, that you guys give them that freedom to say, like, look, I just need you to do what's best for the patient, not what's best for the quote unquote bottom line in that sense.
100%, because it would be short-sighted to make them salespeople. People know, like patients know, you can feel when your doctor really cares or when your doctor is trying to sell you something. So, like, why would we want patients disappointed, feeling ripped off?
Yeah.
We want them to feel taken care of, and we really want to take care of them, and it all resolves itself.
Yeah, no, it does. And again, you have to have a certain trust in your doctor if you're going to just, take then the medication afterwards. I wouldn't take medication from somebody who I don't trust, as a rule.
True.
So, let's talk a little bit about Dr. Goodprice. Now, I know you're in Little Havana, which is, a place that is near and dear to the hearts of everybody here in Miami. And, let's talk a little bit about what differentiates Dr. Goodprice from, say, your other clinics in Little Havana. Like, let's stick with Little Havana. I feel like Little Havana has a little bit of fama for having, clínicas, right? But I know having been to your location, it just feels different. Walking just from the moment you walk in there. And I'm just wondering if you can kind of walk us through some of the biggest differences that we should keep in mind.
Okay, so the main objective difference is that we don't take insurance. You wouldn't take any insurance at all. We work with out-of-pocket patients and clients only. Mm-hmm. That makes our management and the way we work very easy. So that allows us to really focus on what we want to do, which is work with the patient. We're not thinking, whether are we going to get paid for this or no? Is the insurance going to cover this or it won't cover this? Oh, what paperwork do we need to do? We don't worry about that. So that's one of the main ones. The second difference is that our prices are very affordable.
Yes, they are.
So we try to keep our as much as affordable as we can. And the third, and I think a very important one, and what most patients and clients leave saying this, feeling really taken care of. So the team really, all the team really is committed to taking care of the patient, and we look at them in the eye. We are compassionate. We really feel for them when they come in sick. We really want to help them. We really want to make their experience as fast, as easy, as caring as possible. So I think that's what you mean. What you feel when you walk in.
Yeah, I did see that. I again, when I was there, I did see that. It just came across as very. I'm going to say this I'm going to try not to sound mean when I say this, but it didn't seem like people were being processed like estilo factoría. You know what I mean? It seemed like they were actually taking the time to speak with everyone and understand them, and whether that even be before they walked into the exam room, right? Like it sometimes I think that's something people don't realize is just because you're sitting outside of where you're going to be seen doesn't mean that the experience only begins when you walk through that door. It begins when you literally sit down. They have to feel that level of confidence. And as far as the fact that you guys don't take, the the insurance, I think that's also fantastic because that means, guess what, guys? No hidden costs later. There's no worry that later on you're going to get home and it's like, oh, yeah, that was $20. And then you're going to get 17 different invoices for like, well, that was $20. But this was $100 and you only paid $12. And now you're getting like the math that we have to do sometimes for healthcare. It's like, but wait a minute. I thought this was covered. I always use the example. Of many, many years ago. I went to the emergency room. They diagnosed me with appendicitis. I had to have my appendix taken out. So, okay, I go through that whole process. After the operation, when I got home, I got a bill for the anesthesiologist because the anesthesiologist was out of network. And my response to them was, so did you want me to, at that moment that they're telling me I have to have this operation, and obviously I went through the ER, to start asking, no, who's covered by my insurance? Who's covered? Like, I don't know. I'm not going to, and what if nobody was? So I have to sit there and wait 6 hours until somebody shows up. Like, it just, again, the hoops that we have to jump through sometimes with regard to what's covered, what's not covered, and the bills is insane to me.
It is crazy. Also here, now that you're mentioning, all our prices are upfront, listed upfront.
They are.
Always when you see the doctor asks you, like, for example, I'm going to do this, the flu test. It's $25. Are you okay with it? Or do you prefer we don't do it? You know exactly how much you're going to pay, and you pay right there and then, and you forget about it.
Yeah, there's no surprises. I mean, look, you're already not feeling well. You don't need to feel worse once you see your bill at the end, right?
Or worried, worried like, oh, what's going to happen? How much is it going to be?
Yeah. No, it's crazy. So I want to shift gears for a moment and talk to you, because I know you mentioned working in the nonprofit space, and, with regard to that, I know you've worked with like the Bill and Melinda Gates Foundation, and you also founded an organization in Mexico, if I'm remembering your bio correctly. It's Fundación Niños de Eugenia. Can you talk to us a little bit about that?
Yeah, so I founded that when I was 20 years old. That was a long time ago. And I founded it because my sister passed away. Her name was Eugenia, and she loved kids. So first we built one orphanage for 28 girls, and then we built the second one for 32 boys. And so they're still up and running. There's been around 500 kids that have gone through that organization. They grow up. They grow up there. They are taken care of. They go to school outside, but it's like their home. Mm-hmm. And it's a beautiful organization. I in fact lived there like 3 years of my life. I was like, la novicia rebelde, living in the or with the kids. It's really amazing.
I think that speaks so much to who you are. I mean, at 20 years old, I don't think I would have founded a club, much less a foundation and an orphanage, to help children. Like, again, hearing your story and hearing what you've done in the past, and the fact that you're continuing to do that now, and in the broad scope, you're really all about helping people. And I think that's something that, eso nace. Like, that's not something you can force, right? And I think, look, first of all, I commend you. I think it's not an easy task to do any of this, but you know what? Yeah, you should be able to make a little, a living out of it. There's nothing wrong with that. But at the end of the day, you're still giving back, even if it's, in a for-profit scenario. And I just have to applaud you for that, because that's like, again, I couldn't do it. I just wouldn't know where to begin.
Thank you so much. It's very cliche, but it's true that when you give, you receive more. Like the reward I feel when I see people coming into the clinic who haven't seen a doctor for years, because there's so many people who come in and they tell us, I've been living in the US for 15, 20 years, I promise. You can't believe it. And they're like, I've never seen a doctor here. And it's crazy, right? So and you see so many stories of people who would otherwise have no other option. And you know what? I just got sick last week with flu, and I realized because you don't realize how health is so important. If you don't have health, you have nothing.
That's right.
Last week I didn't want to do anything. I didn't want to move. Nothing mattered to me. So it's amazing to be able to help people get their health back and take care of their health and prevent worse things coming to them.
Yeah, that's true, because once you get sick, if you don't take care of it, it can get really bad really fast, certain things. So
Yes, and there's so many also diseases that are like, like diabetes and heart disease, like that are preventable, that you can live a long life, a long health, like life with that if you take care of it, rather than letting it happen, and then like so many complications come out of them that really affect your life.
yeah, again, it can snowball way out of control if you don't take care of things. So, speaking of taking care of things, I know that you guys are currently, like I said, you're in Little Havana, but you're looking to explore, to expand into other locations, right? Is that, did I hear that right from a little bird?
Yes. So we started with this as a pilot. We didn't know if it was going to work out. No, it's been a year and a half where we've improved improved the workflow, improved the patient, the experience for the patient, and we've grown, and we realized that it did work out. So now we want to build a second clinic, but we want to build a second clinic that's much bigger, so we can have many more doctors and many more patients and more services. So we're looking, and we haven't found the right location, but hopefully we will soon.
Yeah, I think the right location will find you. You'll know the right spot. Yeah,
I agree.
Absolutely. Well, Jessica, that's one of those things that I struggle with, being, Spanish and English. It's like sometimes I forget which way to pronounce. Thank you so much, not just for joining us, but for putting this together, for creating Dr. Goodprice and this model that, I think most people automatically think of it in the sense of, oh, well, if I don't have insurance, or like you were saying, people who are here undocumented, or things of that nature. But it's like, no, you can find yourself unemployed tomorrow. And where do you go? Right? Like, you've been here your whole life. Now you're sick. What do you do? Where do you go? At least, now they have Dr. Goodprice, where they can walk through the door and right up front have somebody take care of them. So I think that's fantastic. And I commend you and your staff for doing it.
Thank you so much, and thank you so much for this interview.
All right. Take care.
You too. Bye.
Bye.
Pero Let Me Tell You is co-hosted by Darian Borges and Ismaeliano, produced by Ismaeliano, and our theme, Pero Let Me Tell You Freestyle, is composed by Michael Angelo Lamleplex, the official gay guy. And don't forget to subscribe and leave us a review on iTunes.